the point of the student-led Lunch and Learns is to hear from students and to have you talk to each other. So I'm going to shut up as soon as I possibly can, and then have a conversation afterwards. So we're going to have a little movie clip that will give us some astonishing facts. And then we're going to hear from Joan Ingram and Anne-Marie Davy from the SNAP Ed program. They're located in the public health wing, the new name of which I don't have memorized, I'm sorry. And then we're going to hear from some students, and these are quick 5-minute presentations talking about student perspectives from their profession about nutrition. So we're going to hear from Lauren Schiemann, who's a physician assistant. We're going to hear from Wendy Briggs from social work. We have 2 dynamic dental teams who will be presenting to us, and a great pharmacy team who will be presenting to us. And then we have a guest, Susan Gay from Hannaford, who's a nutritionist there. She's going to talk to us about that. And then we're going to get down to a conversation. Because we were interested in capturing the conversation, we do have our videographer here, Dave De Diego, who you are all familiar with seeing. So I will be asking you to speak into the mic when you do speak, but nobody's died yet from speaking into the mic, so please play along. So I'm just going to cue up our quick video clip here.
For instance, where the Southeast has a higher frequency than, say, Colorado.
The rates of chronic disease are much higher in low-income communities, and the rates of obesity-related chronic disease are way higher.
Just the built environment that people live in, their access to nutritious food as opposed to things that are high in calories and relatively low in nutritive value.
It's systematically different in communities of color and communities with lower incomes.
Where you live matters, and it matters a lot. Another way of putting this is, does your zip code matter more than your genetic code? This is Baltimore, Maryland, where they have a census tract down near the Inner Harbor with a life expectancy of 62 years, and another life expectancy up in northern Baltimore, 82 years, a 20-year life expectancy difference. This is Cuyahoga County, Cleveland, where we thus far have found the greatest disparity in life expectancy. This is Huff, an inner city neighborhood with the average life expectancy of 64 years, and 8 miles down the road is Lyndhurst with a life expectancy of close to 90 years. Understanding what drives that disparity is going to help us understand what is driving the chronic disease epidemic. It's going to help us understand the tools and strategies to get underneath the obesity epidemic.
That's an HBO movie called The Weight of the Nation, and it's worth a watch. And I think I'm going to turn it over to Joan.
Anne-Marie, I'll call you up after. So, hi everyone, thanks for having us today. We're going to give a quick, just kind of set the framework about SNAP and SNAP Ed. And I'm going to step us back a minute just in case folks don't know. SNAP is the Supplemental Nutrition Assistance Program, formerly known as food stamps. And Anne-Marie and myself work at the School of Community and Population Health running the SNAP Ed program for Maine. So a little bit more about, again, that video is a great intro, but what's hunger like, what's poverty like, what's food insecurity like in Maine? Maine has the 3rd highest rate of hunger in the nation and the highest in New England. I'm going to throw a few statistics at you, but it kind of sets the framework. 1 in 4 children in Maine live in a food insecure home. So food insecurity means basically you don't know when or where your next meal is going to come from. SNAP dollars feed about 250,000 million Mainers, so about 252,000, and that's about 1 in 5 Mainers, and nationwide it's about 1 in 7. So we have a slightly higher rate of SNAP participation. Almost 64% of SNAP participants are in families with children, and almost 45% of SNAP participants are in working families. Almost 3/4 of households receiving SNAP benefits have income below the poverty level, which is about $22,000 annually for a family of 4. So in Maine, we also had a recent, which folks might know about, and if there are questions later, we can get into it, but a reduction in SNAP benefits. So this already pretty minimal amount was reduced as of November 1st because there were stimulus funds that were coming in, and those ended on November 1. So what that means is in Maine, it cuts benefits to a family by about $36 a month. Might not seem like a lot, but that's substantial. It's a substantial amount of what was coming in. So that's less than $1.40 per meal per person. Probably not even kind of what we could get on our plates. So again, the Farm Bill, I'm not going to go into this, but just that's where SNAP is funded. So if people hear about the Farm Bill being, it's being conferenced right now by a joint committee of the House and Senate about future cuts to SNAP. So that's kind of where the SNAP funding comes from. So SNAP Ed. So the goal of the SNAP Ed program is to improve that the likelihood that persons eligible for SNAP will make healthier food choices and choose more physically active lifestyles. And it's really a focus on increasing fruit and veggie intake and shopping on a limited budget and buying healthier foods on a limited budget. That's the primary focus. There is a little bit of physical activity, but it's more on nutrition. And in 2013, the Healthy Hunger Free Kids Act really transitioned SNAP Ed to be more of a public health approach. It used to be a lot more one-on-one nutrition counseling, and now it's really about trying to incorporate the education into some policy systems, environmental changes. Similar to what we saw in that video, we can only ask an individual to make so many choices, but we have a society where it's really much easier to make an unhealthy choice than it is a healthy choice, and particularly our low-income families. So in Maine, again, we heard it in the video, but why does it matter in Maine? So we have these high rates of food insecurity. We also have high rates of obesity. 1/3 of Mainers are overweight or obese. 1/3 of all kindergarten children are overweight or obese. So we have this juxtaposition of hunger and obesity. And it's no surprise, again, when the food choices, the access, the added stress are all complications that our low-income families face at a much higher rate than others. So I'm going to transition to Anne-Marie, who's going to tell you a little bit about the work we do on the ground, but essentially what we have in Maine, Maine has over $3 million coming in for SNAP education work. It comes to the Maine DHHS, and then it comes to UNE, who we're the implementing agency for the program. And we work through the local public health infrastructure, the Healthy Maine Partnership, some of you might know, HMPs, and they hire nutrition educators who actually do these classes on the ground. Whether it's in schools, they do cooking skills classes, shopping tours, things like that. So Anne-Marie's going to give you a little, case study so you can kind of feel what it's like on the ground.
Hi. I'm the Senior Nutrition Education Program Coordinator for our SNAP program statewide, and I'm really mentoring and helping our 40 nutrition educators across the state teach SNAP participants and eligibles how to make healthy choices on a budget. Our goal is that 25% of them will increase their fruit and vegetable intake by half a cup over baseline, that they'll increase their physical activity by 10 minutes a day over our baseline, and that 1/3 of them will increase their hand washing on a daily basis using appropriate techniques. So these are our key objectives. So as Joan mentioned, we've got 8 different curricula, nutrition education curricula, that we are implementing statewide, and they focus on the whole age spectrum. So we start with an Eat Well, Play Hard curriculum in childcare settings. Then we move to a Pick a Better Snack and Act for grades kindergarten through 3. Then for grades 4 to 6, we teach Nutrition to Grow On, where we have some gardening activities. For middle school students, we teach Eat Fit. And also for middle school students, we teach Cooking Matters. And for adults, we teach Cooking Matters. As many of you may be aware, there's no longer home ec classes or no more basic life skills classes. So these teens are really interested in learning how to cook and make their own food choices. So we do that for adults as well. We take them on grocery store tours and teach them how to read a unit price tag or how to decide which would be the better buy and what choices would be healthier amongst 30,000 items in the grocery store. And then for seniors, we have an Eat Smart, Live Strong program, which is really teaching them about basic warm-up physical activities that you could do from your chair, and then some basic cooking skills for 1 or 2 people. And lastly, we have a whole series of single session nutrition education sessions that our nutrition educators would do in a farmer's market, at a food pantry, in different settings where they would only be there once with a very specific message. So you're going to hear us talk a lot about 3 messages in each of our curriculum. Make half your plates fruits and vegetables, make half your grains whole, and switch to low-fat or non-fat dairy products. Now, for us, those may seem real easy, but as I'm going on store tours with some of our participants, they may not have a refrigerator, may not have a freezer, living day to day. When we say buy in bulk or look for what's on sale, they're like, I just want my next meal. We're talking, as Joan said, $1.40 a meal per day, each meal for them that they have to spend. I was standing yesterday next to a teenage mom who has 1 child. She didn't graduate from high school. She's living in a trailer with her boyfriend, who is a farm hand, and they only have enough storage in their trailer to have the food that they can eat for that day. So even though we had a $10 gift certificate, she could not take those foods and store them in her trailer. On the other side was a retired Army nurse who's disabled in a wheelchair, lives just around the corner from the grocery store, doesn't have a vehicle, and she's living at home with her autistic 20-year-old child. So these are the folks that we're trying to teach how to make it, how to eat healthy, on a budget, reduce their risk for chronic disease, yet they're struggling day to day with, where's my next meal? Am I going to have someplace warm to sleep or live? And just how to get through what we would normally take for granted. So it's a compelling population in Maine of 252,000. So I'll leave you with that.
Hi, everyone. I'm Lauren. I'm a physician assistant student here at UNE, and I actually got my Bachelor's of Science in Human Nutrition, so I kind of want to do a transition into how us as students can really use the preventative care that medical nutrition has. So first off, in general, preventative medicine really focuses on the health of individuals, communities, and defined populations, similar to what we saw in the video shown earlier. Really, those underserved populations, the poor income families, they really do not have the resources. So preventative medicine is really important to promote in those communities. So the main goal of preventative medicine in general is to protect, promote, maintain health and well-being, as well as to prevent disease, disability, and premature death. So these actions are taken to prevent diseases rather than really focusing on treating symptoms, so prevention is key. So just some general examples of preventative medicine I included was the promotion of physical activity, some prudent dietary practices, smoking cessation, as well as getting vaccinations, and as well as what the SNAP program brought up, just promoting health in general. So looking more specifically on how to incorporate nutrition as a medical therapy, obviously we saw in the video that obesity has become more and more prevalent. But we also know that many other diseases can develop or be made worse by an improper diet. So the goal of medical nutrition therapy is to treat medical conditions as well as the associated symptoms by a tailored diet. So a nutrient-dense whole food diet as well as some supplementation can be prescribed to hopefully return the patient back to their optimal state of health. So I said more specific examples are to treat diabetes, hypertension, high cholesterol, obesity. I mean, us as physician assistants, we're currently in our cardiovascular module, so this is totally applicable to what we have been learning, just, you know, well-structured diet to prevent the many diseases that obesity and diabetes can bring. So then I kind of tie this into what us as physician assistants can do. We can promote preventative practices to kind of heat off those medical conditions. We can learn to integrate the conventional medicine that we're so used to prescribing off, you know, different pharmaceuticals and drugs, but kind of tying that into the medical nutrition therapy and prevention of the diseases. And also to recommend lifestyle or dietary changes. Us as physician assistant students, we do have to write our assessment and plans, and just learning how to incorporate more lifestyle changes rather than over-prescribing medicine for certain medical conditions. And then also going along with our integrative professionalism, just maintaining an open communication with registered dietitians, really working on that preventative health care, and integrating other professions, which you'll probably hear from more today. And that's it.
Thank you. Wendy, you're up, and Alex and team, you're on deck.
Hi, I'm Wendy Briggs. I'm from the School of Social Work, so the non-medical profession represented here. And I am going to give you a quick, brief history of medicine. 2000 BC, here, eat this root. 1000 AD, that root is heathen, say this prayer. 1850 AD, that prayer is superstition, drink this potion. 1940, that potion is snake oil, swallow this pill. 1985, that pill is ineffective, take this antibiotic. 2008, that antibiotic is artificial, here, eat this root. So we're beginning to understand the role of nutrition and health, and it is no longer considered alternative medicine and is often at the heart of good integrative health practice. When my kids are growing up, when they would come to me misbehaving or not feeling well, I had these series of questions that I asked them. You know, what are you eating? Who are you playing with on the playground? How are you sleeping? And how are you pooping? You know, the big important pieces, and basically this is social work. Social workers understand that our health and well-being is directly affected by emotional, mental, and social and environmental factors. We're keenly aware of the effects of social injustice on health, and as a result, we're in a constant state of advocacy. So you're going to hear a little bit of that today. And in many ways, food is the bridge between that external structure and the internal structure. And we got a little bit of a snapshot from the external structure in Maine about some of the food inequities and the rates of obesity in Maine. And there is that paradox also in that anorexia is the third most common chronic illness among adolescents. And the mortality rate associated with anorexia is 12 times higher than the death rate associated with all causes of death for females between the ages of 15 and 24. So, you know, what does it say about our society where we have, on the one hand, hunger, obesity, and anorexia? So just sort of posing that question out there. We know that in this country, hunger is multi-generational. Children who grow up hungry are more likely to be hungry as adults. In addition, to economic mobility, improper nutrition in early childhood, and even in utero. So there's some connection saying that low birth weight babies, so babies born into poverty, actually have higher rates of obesity as adults. But this lack of nutrition can create cognitive, emotional, behavioral, and chronic physical issues in adulthood. So that's sort of looking at it from the external system. Looking at it from the internal system, we know that chronic stress interrupts the endocrine system, and I'm sure that some of you more medical folks can speak to that. But that's what helps us to metabolize food. So there's really a connection between stress and obesity. Stress and poor food choices result in obesity, which is often at the, and you spoke about, sort of at the core of a lot of the chronic health issues that we see, such as heart disease, diabetes, depression, anxiety, and structural issues like lumbar stenosis and osteoarthritis in the knee. Early malnutrition predisposes children to behavioral problems. A child malnourished at 3 will tend to be more aggressive and hyperactive at 8, and show increased hyperactivity and conduct disorder at 17. So something to kind of keep in mind. There was an article that I read in the British Journal of Psychiatry, which did a study on vitamins with incarcerated youth. And they found that there was a 35% reduction in disciplinary offenses and a 37% decrease in violence incidents just by giving these young people vitamins. Emerging research also shows a connection between specific nutritional deficiencies such as B12, omega fatty acids, folic acid, zinc, and creatine with depression, suicide, and other mental illnesses. So that may be something that hopefully in the future we check more in regular PCP appointments, that maybe we look more into the actual nutritional deficiencies in individuals. And we're really beginning to understand the ripples of poor nutritional access. So I work, I'm interning at the Family Medicine Center, which is an integrative model. And I just wanted to give you just some anecdotal, so 3 vignettes of some patients that I've been working with. One has recently been released from prison where he was incarcerated for 23 years. He's obese, he has diabetes, heart disease, just had back surgeries, getting a knee, some knee injections. And, you know, some of his care teams see the fact that he is unable to manage his diet and his insulin injections as being non-compliant. And I see it, as I've been working, as an individual for 23 years has been told exactly what to eat, when to eat it, has been given a pair of shoes in September. So his sense of self to self-manage is pretty low. So my job is to really kind of reach in and help to strengthen that muscle. I also have a patient who has chronic GI distress. He has been in severe pain, lots of testing. No one can quite figure out what the problem is. He has a history of really traumatic childhood abuse. And often within the medical system, he's looked at as drug seeking. So to kind of look at our patients in this holistic sense, rather than just by their diagnosis or the symptoms that they bring in, I think is really important. And one final anecdote, I recently had an interaction with a nurse practitioner, really wonderful practitioner, But she was kind of rolling her eyes when a young mother came in with her son, and the mother said, if you're good for the doctor and let her listen to your lungs, we can go to McDonald's as a treat. And she was kind of rolling her eyes. And I feel like we all like to celebrate successes, achievements. And for some poor families, McDonald's is their only option. So to just really be aware of some of the judgments, and we all have judgments surrounding food. Food is a hugely culturally deep, it's the first thing we do often. When we come out of the womb, that's the first thing we do. It's very, very connected with so many things. So to just be aware as practitioners of what those judgments are, because I think it will help us to be much more compassionate, effective practitioners. So thank you.
Thank you.
Hi, good afternoon. My name is Alex Kerbaugh. This is Tan Hun and Jordan Dunn, and we're with the D1 Dental School. I guess we're the only students in the dental school these days. As many of you are probably aware, oral health has been related to overall health in countless studies, whether pertaining to cardiac disease or cancer disease. So it makes perfect sense that oral health would be related to overall health, because if you think about it, your mouth represents the largest breach in your protective skin barrier in your entire body. And it's conveniently located smack dab in the middle of your face. So it's increasingly important to take care of your oral health and monitor your health and what you put into it. Throughout our day-to-day lives, we're constantly filling our mouths with lots of different fluids, whether for hydration, taste, or even recreation. And what dental presentation is not complete without a grotesquely disgusting picture of a mouth? And since you guys are all eating, I thought I'd cover up with something a little bit more modest, but just as threatening. So what causes this destruction in teeth? Is it those inconsiderate bacteria that make your mouth their home? Probably, and in fact it is. Because what happens is when they feed, they use the food that you put into your mouth, these fermentable carbohydrates, and they break it down through anaerobic respiration, and that lowers the pH in your mouth, because anaerobic respiration, unfortunately, has a byproduct of acid. And what this does is it lowers the acid in your mouth into a lower critical pH. And at this low critical pH level is when we see the onset of demineralization. And if you can see by the slides here, your outer protective layer of your teeth, the enamel, has a lower critical pH than your inner layer of your teeth, the dentin. Your enamel critical pH is around 5.5, and your dentin pH is around 6.2. So unfortunately, if your mouth is sustained at a lower pH long enough to break through the enamel and get to the dentin, it'll spread rapidly through the dentin and cause that disgusting picture that we just saw just a moment ago. This illustration shows the 4 main modifying factors that go into karyogenic activity. The 4 main factors are host, time, biofilm, and carbohydrates. The most important ones in pertaining to drinks is carbohydrates and time. Because unlike with foods, we're drinking throughout the day. And many of us will constantly be sipping on different sorts of drinks, which constantly lowers the pH in our mouth, giving an even more hospitable environment to karyogenic bacteria. Shortly after eating or drinking, you can see from these charts that the pH drops dramatically in your mouth, and it takes a while for this to bounce back. The demineralization is caused because the lower pH in your mouth drives the calcium and phosphate ions out of your teeth into the biofilm to establish an equilibrium. Now, until your mouth has gone above that critical limit, remineralization cannot occur. So if you keep drinking throughout the day, lowering your pH down below this critical level, you'll continually harbor more bacteria and give a more acidic environment, leading to a more increased demineralization. This is a list of common drinks, and as you can see, most of them are below this critical acidic level. And so, unless you're only drinking milk, water, or human blood if you're a vampire, you really have to monitor the quantity and the frequency of the drinks that you're taking in. Tan?
So I'm just going to go over the adverse effects of the most common drinks that we drink. Okay, so the American Heart Association recommends limiting the sugar consumption to 6 teaspoons per day for women and 9 teaspoons per day for men. And so 1 teaspoon is 4 grams of sugar. So that means that for women, you can have up to 24 grams of sugar, and men for 36 grams. And a bottle of Coke has 39 grams of sugar. So 1 bottle of Coke would mean that you already go over the limits for the consumption per day. And for soda contains a high level of high fructose corn syrup, which is linked to increased diabetes and obesity. Soda also have a high content of phosphoric acid, which is linked to muscle loss and accelerated aging. And for diet soda doesn't have any sugar, but it does contain a lot of artificial sweetener, which is linked to carcinogenic and reproductive and neurological effects. For coffee contains a high level of tannic acid, which can stain your teeth. And depending on the type of coffee that you drink, non-skim milk and non-sugary coffee is recommended. Starbucks, for a typical Starbucks Frappuccino has 60 grams of sugar. So that's almost double the amount that you need per day. And for sport drink, in 2006, the study showed that sport drink does not prevent hyponatremia, which ironically is not what it should be used for. And sports drink also contain a high level of natural flavor and high acidity. For vitamin water, instead of high fructose corn syrups, it contains crystalline fructose, which can be linked to liver disease, obesity, and heart disease. And it also contains a high level of natural flavor. And when on the label it says natural flavor, usually it's not really specific, and it can be just anything that they can put in. An example of the natural flavor can be benzoyl acetates, which can cause a gastrointestinal irritation. For fruit juice does contain a lot of vitamin, but it does not have as much fiber as in whole fruits. And it does also contain high acidity. And lemon juice is one of the most acidic drinks that you can have.
So we now have some suggestions for some healthy alternatives. Gatorade has a lot of sugar. It also has a very low pH, which means that it's acidic. Both are things that your bacterial biofilm love. Vitamin water, 1 bottle can have up to 2 tablespoons or more of sugar, which means that if you're a female, you're already over your daily limit, and if you're a male, you are just below it. And some healthy alternatives are water and milk. Water's great. It has no calories, no sugar. It hydrates you. You need water for many of your metabolic processes. Milk also has less sugar, and it has a lot of vitamins in it, which are natural compared to vitamin water. Coffee, most of us need something to get us going in the morning. Coffee has a pH of about 5.3 to 5.5, which is right at the level for enamel demineralization. Instead of drinking coffee, you can try tea, which has a higher pH, and it also contains some antioxidants. Fruit juice, as Tom just mentioned, has citric acid, which is very acidic, as well as lots of natural sugars. In order to make this a little bit better for us, you can dilute it with water or seltzer water to make your own version of a mocktail. And some other options are to steep water with either fruit or vegetable slices, which makes a nice, refreshing drink. Some people like to indulge in alcohol. Alcohol is not always the best for us. Mixed drinks are the worst for us because they contain a lot of sugar as well as a very low pH. some healthy alternatives, well, not necessarily healthy, but better for you, is red wine or white wine. The pH is still very low. However, red wine has some antioxidants which can help with overall health. Also, a great one is a gin and tonic. And then in regards to both drinks and food, if you happen to have an unhealthy snack, xylitol sugar substitute gum is a great way to increase your salivary flow, which helps to remove bacteria that have not adhered to your teeth yet. Xylitol is a non-fermentable sugar alcohol, so it's not going to feed the biofilm that is already on your teeth, and it also helps to reduce the plaque formation. And that's what we have for today. Thank you very much.
Thank you. I can feel myself demineralizing right now. Next, we're going to hear from pharmacy. How's everybody doing? Is this working out for you? You learning some stuff? I promise we'll get to the conversation part, I swear. Ladies, do you have your grapefruits? Thanks. Do you need me to write? All right, just do it.
It's not necessary. Hi, everyone. I'm Andrea. I'm a third-year pharmacy student.
And I'm Brittany. I'm a third-year pharmacy student.
And I'm Megan, and I'm a third-year pharmacy student.
And who here likes grapefruit?
Test.
Who here likes alcohol?
Everyone should be raising their hand at that. I know it. Who likes leafy green vegetables?
Who here likes milk?
What about licorice? Oh, come on.
And chocolate?
Is that it? Okay. So all of these foods can actually interact with very common medications, and we're here to talk to you about that.
The most common one is grapefruit. Who has had the auxiliary label for grapefruit stuck on their medication before?
Or your patient's medication. So can anyone tell me what major drug class that is known to interact with grapefruit? Statins, that is correct. So would you like to talk about?
Okay, well, it breaks down to, it's a component of grapefruit called bergamottin. It causes the CYP enzyme in the gut to, actually it binds to it so that it doesn't work anymore, and it takes 24 hours minimal for the enzyme to regenerate in the body. It doesn't affect the liver enzyme, which we all learn about in pharmacy school, the CYP3A4 with all the medications. It actually takes 2 to 3 liters for it to work in the liver, and it's only a minimal effect. But with the enzyme in the gut, it only takes 1 cup or 1 grapefruit to have the interaction.
Yep, so regardless of how much you're having, you can still have a drug interaction. So it's important to make sure your patients are eating appropriate foods for their medications. Would you like to talk about leafy greens?
So another thing that interacts, leafy green vegetables are important to our diet because getting a variety of fruits and vegetables is good for our health. One of the medications, warfarin, that a lot of patients are on, has serious drug interaction with leafy green vegetables. And on that point, it's really important for counseling for the patient to know that they can still eat leafy green vegetables, but they should be eating them in moderation and eating them consistently. And it's important to know how to counsel patients a lot of times on their diet, because if you just tell them to avoid leafy green vegetables, you're cutting out a big nutrient in their diet. So that's something to think about.
All right, I guess I'll talk about CNS depressants like painkillers and stuff with alcohol. So as you know, alcohol is a CNS depressant, and you may or may not have experienced those effects. So taking your CNS depressants with alcohol can potentiate that effect and cause respiratory depression or stuff like that. So that can become dangerous in certain cases.
Milk has an interaction with antibiotics like tetracyclines, minocycline, doxycycline, which doxy is especially used for Lyme disease, and it can chelate with the ions in the milk, such as magnesium, copper, and then it doesn't work anymore in the body.
Let's see.
And then one other important thing to note is that some medications need to be taken with food for them to be absorbed properly in the body. So in cases where people are struggling with food insecurity and they don't know where their next meal is coming from, if they're told to take that medication 3 times per day, that can be a real challenge for them to get that with food. So they might be at more risk for side effects from medications, or they might not get the full benefit of their medications.
So how can we as healthcare providers make sure that our patients are eating appropriate foods for our medications? Any ideas? Oh, statins are prescribed for cholesterol. Yes. Sorry.
There's some applications that you can use on your phone so you can tell your patients about it so that they can look up a drug-food interaction, such as drugs.com medication guide, generic drugs encyclopedia, and natural medicines database. And the last one especially has like herbal supplements and other supplements that you can use, and it shows interactions.
What questions do you have for us? Okay. Yes?
So are there certain medications that hurt with absorption of nutrients? I'm thinking of like young kids who are prescribed medications for ADHD, which tends to be older kids, if that is adding to their inability to absorb proper nutrients, if there's any evidence to show.
So she asked about drugs that might interfere with absorption of nutrients. Is that correct?
It's sort of the opposite, where you're talking about food.
Oh, okay.
Medications less effective. I'm wondering if there are medications that make food absorption less effective.
Well, ADHD medications speed up the metabolism so that they can actually lose weight. And then also with like the tetracyclines and fluoroquinolones, like ciprofloxacin and other ones like that, it actually can cause a decrease in growth in children, and then can cause tendinitis.
I could jump in this preceptor game for at least a little while. And there are a variety of medicines that we've been finding, especially long-term use. Some of the common medications we think of with that are those that block stomach acid. So everyone's probably heard of the proton pump inhibitor class.
Yep.
So things like omeprazole and prilosec OTC that you guys see on your shelves. Those drugs are designed for short-term use, but everyone's been using them for years and years at a time, which is not what they're designed for. And as a result, we've now done studies and seen that patients who have been on them for years and years have certain vitamin and mineral deficiencies, especially things like calcium. We're at bone health in our older patients and things like that. Some of the less acid blocking medications, we haven't seen it quite as much, but proton pump inhibitors definitely. There's also some other medications for long-term use. We've seen association with some vitamin deficiencies, but that's the only one where it seems very causative in terms of it lowers the gastric pH to the degree that we're not absorbing nutrients as well. Pardon? Bile aspirins as well. So he's mentioning we don't use those quite, they're not as common of a class, but they're another class of medicines that we might use to lower cholesterol. And when we think about lowering cholesterol medicines like the statins or like this, these are the medicines we're using in our patient population who are obese and overweight and having some of these other issues that we've been discussing. And those also can inhibit vitamin and mineral absorption because they bind to it, just like she was mentioning with the antibiotics that bind. So it's definitely something to worry about. And in those cases, we want to try to counsel patients on separating foods from vitamins, or separating foods from the medications or vitamins from those medicines. But if their diets are inconsistent due to food insecurity and other issues, that's a very difficult thing to ask of them to do. Sorry, I'm getting you.
Hello, my name is Ben, and this is Katie, my partner for today. And first of all, yeah, sorry, that was probably not a good introduction. So today, just want to first say thank you for allowing us to participate, and hopefully we'll provide some sense of benefit here. So let me get started with a brief introduction. Today is mainly talking about you or us as professionals and what we can do or what role we play in the overall scheme of things when it comes to overall health and diet and how we serve our patients. So we're going to begin by talking about the doctor's health, then moving to the patient's health, and how that leads to a patient-doctor relationship. And then how do you balance everything together, just in life in general?
So as Ben was mentioning, there is this doctor-patient relationship that will develop, and they really feed off of one another. When we sign up to be in our profession of helping people, whether we're in dentistry, pharmacy, social work, anything, we're helping people. And that inevitably makes us role models. I know from personal experience, I have 2 young nieces, and they look up to me all the time. They might develop mannerisms that I don't want them to, so that teaches us to kind of reevaluate ourselves. And it's very important. This relationship can go into all aspects of your life, not just with your patients, but it's important to be open and have them comfortable with you and you comfortable with them.
So, as was mentioned earlier, actually, we constantly have our autonomic nervous system working, and we're battling between what are we doing in life to either generate, are we on a sympathetic or are we in a parasympathetic world? Parasympathetic being rest and digest, and sympathetic fight or flight. So are we continually being stressed, or what's happening in life around us that may impact or affect which gear we're living on? Where are we more tailored? What are we more tailored to? Something to be aware of, cognitive of. So I'll ask you, where do you live? Today. Where are you today? That picture was very illustrative of a balance, and it's important to maintain that balance. And stepping back a moment and looking at a bigger picture, as you can see, as illustrated in this diagram, how we funnel together multiple components or compartments of our lives that all affect our overall health. And I'll begin with lifestyle and attitude. It's up to us to decide how are we going to approach this day, and our attitude. And lifestyle, what type of lifestyle do you live? Are you being active, or are you being healthy? Are you making good decisions? Are you making good choices? Stress, again, going back to parasympathetic, sympathetic. Another one is to think about, don't always take the easy road. It's easy to go through life and just say, okay, what's going to be the easiest thing to do? But it's important to look down the road. What is this decision today going to mean in the future?
And there's actually a study done in China, and those people who had automobiles and chose that as their mode of transportation as opposed to biking or walking were actually 80% more likely to be obese. Now you think, how does that relate to us here in America? We're driving down the road in our car. What do we see every few miles? A McDonald's, Burger King, fast food. So it's making those choices. Don't always take the convenient. Yes, it's quick and easy. Sometimes we don't even think about it. We're there, how can I help you? What can I order for you? Before we even realize, oh, I'm at McDonald's, I don't want to be here. And so that has a lot to do with our environment.
Exactly. And that leads into our next component, environment and responsibilities. We all have responsibilities. Some are greater, some are not. But it's important for us to balance and juggle those responsibilities with to make sure that we're not overworking ourselves, or we're in a comfortable zone that we're being, so that we may be effective to who we're speaking with or who we're trying to treat. Family and leisure. I know for me, family is one of the bigger components of this funnel, but you know, it's important for us to take time, step back, reevaluate our lives, what's important to us, and I think by doing that, that helps generate a better sense of self, a better sense of your capabilities and what this world means. The better you feel about yourself, the more effective you're going to be as a practitioner. However, it takes encouragement. It's not easy to always be happy. It's not always easy to be healthy. It's not easy to make good decisions. So Katie will talk about encouragement.
So it's always nice when you have somebody there telling you, take this step, do this next. But not all of us have somebody like that in our lives. And especially us as healthcare professionals or just role models, leaders, it's us to self-motivate ourselves so we can motivate our patients. And so these are just some of the core concepts that we thought were most important. I'm just going to start with prepping and planning. If you have a luxury to have your meals right there for you, you can plan them. Why not? I'm going to have this for lunch at 12:30, and this is, you know, when you get really hungry but it's not time for dinner yet, have it there. Then you don't have to worry about it. You're not stressed out. You know what's coming. And the next thing is really important is serving size. So we can see here it says 190 calories. So you might grab that. That's wonderful. I didn't go over my 300 or whatever you're limiting yourself. But then if you look where it says servings per container, that's over 6. So you're eating this one container of whatever it may be, I'm not quite sure, and you're getting way more than what you bargained for. And not just calories. There's the carbohydrates, the cholesterol, everything. So it's really important to look. And it goes back to prepping and planning. If you're planning your own meals, you know what you're putting in your body. And this next part might seem kind of juvenile, but it's so important just to take a step back, breathe, relax. Whether you're frustrated or just work it into your day, I promise, take a couple deep breaths. Nobody has to watch you. You can go away, so you're going to the bathroom, and you'll come back with a new perspective. And it is not going to happen overnight. It's baby steps. It's a gradual process, little changes here and there.
Yeah, and actually there's a study done that says among U.S. adults, more than 90% of type 2 diabetes, 80% of coronary artery disease, 70% of stroke, and 70% of colon cancer are potentially preventable by a combination of non-smoking, avoidance of being overweight, moderate physical activity, healthy diet, and moderate alcohol consumption. So, as she said, it's not going to happen overnight, but it's astonishing what can happen by just taking little steps every day and by being aware of what you're doing on a daily basis. And again, back to prevention. I mean, this is the number one way of preventing something that could potentially happen in the future. So just be cognizant of what you're doing today affects tomorrow.
And another one of those little changes is water. Instead of ordering that soda or that juice, choose water. It might not seem fun, add fruit, as we have already mentioned, or vegetables, and it tastes delicious, and I promise you'll feel better. You'll notice difference in your skin, your hair, your overall outlook on life. And most importantly to me, have fun with it. If you have children, involve them in this cooking and planning process. If you're like me, I like to just be by myself sometimes in my kitchen. Don't be afraid of it. Experiment with spices and different flavors. Just because it's healthy, it doesn't have to taste bad. Ginger actually is an effective diuretic. Black pepper can help absorb important nutrients, and cinnamon can help reduce blood pressure. Again, everything in balance, however. And so we go back to this diagram that we saw earlier and how the doctor's health, and your patient's health are correlated in this relationship. When sustained and maintained, there are very beneficial outcomes for both involved.
So I'm going to speak to a few of the benefits or the potential benefits that can come from developing that strong relationship with a patient. You know, and actually it's interesting because a lot of what we're talking about today is taking place here locally. You know, we're in America. You know, we have everything at our fingertips. So it's easy to grab things. It's easy to get access to things that potentially are not good for us. Whereas that's not necessarily the case in other countries. It's not easy to get high caloric intake every day because they're struggling for what they get. They're struggling for what they're planting and having to hunt, basically. It's almost the primordial sense. And it's interesting because there's studies that show that in a high-income society, when we make decisions that are responsible, we can reduce the risk of all of these diseases that we are talking about. And furthermore, you look at other countries and look at how low their rates are of the same diseases that we struggle with in America. So you kind of compare those two and correlate, well, what's happening? Why aren't we higher? Now I've lost track of why that was important, but it had a point.
Well, and it's also important if you think your patients, if they see you living a healthy lifestyle, and if you can relate to them on a certain level. Not all of us were born, I grew up eating fried chicken and mashed potatoes almost all the time. So it's, like I said before, it's self-motivating, and we need to show them. And being the best us we can be, we can help them be the best them that they can be. And that's why we're here, to improve the health, to make people happy, feel good, and have healthy, happy, and long lives. So we just want to say thank you for listening to us and inviting us here, and we hope we brought some insight. And these are some of our sources.
Thank you. It's so great to have dental here, and we do this almost every Wednesday, some version of this, so please join us in the future. And now, Susan Gay.
Hi, I'm Susan Gay, and I am a registered dietitian at Hannaford at Forest Avenue. And I feel like my role is point of purchase at the grocery store when folks are trying to follow through with what their physician has told them to do. I'm there to help. And it's on a personal level, and that's what I love so much about it. So, I'll have folks come in and say, oh, I just found out that I'm diabetic. I need to, watch my sugars. What can I do? What can I eat? How can I do it? And of course, budget is always a piece of that as well. So I get to work with people on that personal level. Like, for instance, I used to work for another dietitian in private practice, and I would have an office that was full of boxes and labels that we could look at, and it might not be the granola bar that they typically choose or the cereal that they typically choose. So when we can be there at the grocery store and actually look at exactly what they're eating and choosing, we can maybe tweak it just a little bit and try to make it as personal as possible, and it's less overwhelming. So maybe what they're doing, and lots of times what's exciting is, they do find out that they are eating something that's just fine, that it's okay, and so we don't have to change too much. I like to think of, just taking it as a non-threatening approach to eating healthy and enjoying it, and doing it, like they said, like baby steps. So they'll feel better today and in the future. We talk about that a lot another piece of the job is to go into the schools and talk to the kids, and they don't really think about, living a longer life. They're not thinking when they're in grammar school that they want to be 65 or 75, They want to feel better for their soccer game that evening, or even, their spelling test that morning. So we talk about, how nutrition is such an important piece of how they're going to feel now and, of course, in the future. But so I'm there for anybody that wants to come in and either bring their families or small groups, like Ella Bean will bring in a small group to the store, and we'll do tours and do unit pricing and that kind of thing. So thank you for inviting me here today. And I've enjoyed everybody else's conversation as well. It's fun to listen to other professions talking about the importance of nutrition, and not just hearing us dietitians always talking, because we know how important it is to us, but not necessarily on everybody else's radar. So I appreciate that. So thank you.
Thank you, and thanks for being a resource for us. So now I think we should take the advice of one of our presenters and take a couple of very deep breaths, even though we're not alone. Maybe wiggle around a little bit in your chair. That was a long time to sit, but I think we heard some great stuff. And now I would say, so what? What does it matter to you as a student for your profession? And if you have questions that came up or additional points you want to make, we're going to circulate with the mics and let's just talk. I'll choose someone.
As I was listening to all the presentations, I think I just want to comment on a common thread, and if you don't remember anything else, just remember you are what you eat. So our bodies are dynamic, magnificent machines that are greatly impacted by the nutrients that we put in them on a day-to-day basis. And if only people would think about that when they're making their food decisions instead of how does it look, how does it taste, how fast can I eat it, what does it cost, thinking what is it doing in my body. So you are what you eat.
I just wanted to say I know not everybody has the luxury to get organic or fresh, homegrown vegetables and fruits. But even if McDonald's is your only option or you have to get something quick, nowadays it's so wonderful because I know even at Subway you think, oh, that's the healthiest place you can go. Not necessarily, but instead of getting a bag of chips, have a bag of sliced apples that they have. Instead of dipping it in chocolate or caramel sauce, choose peanut butter or Greek yogurt, just little things like that I think is nice. People think fast food has to be disgusting and bad for you. It's not the greatest, but you can choose a little bit better even at those places.
Do you have any thoughts about barriers in your practice as you see clients? Would you want to talk about this? Someone behind me.
So my question is basically for anyone that can answer it. Like me, I'm allergic to basically every fruit and vegetable there is out there. So what kinds of things can I do or can I offer to one of my patients one day for them to be substituting something and eating it healthy? Like a healthier way of eating for people that are allergic to fruits.
Let me just say that I'm sorry that that has happened to you. Wow. Who wants to take that?
To all fruits? Okay. So that's what I would say, certainly stick to the ones that you can eat and then just stay on top of it as far as, nutrient deficiencies and making sure that if you need to supplement, whether it be iron or B12 or whatnot, vitamin C, if you're not getting that, so I'd stick to the ones that you can eat and then supplement if you need to.
I appreciated the SNAP presentation and the pharmacy presentation, especially when they started to talk about the things that you should not eat given certain medications. And so I'm very impressed with the number of programs that you have at the different levels in life. Is there much in the way of paying attention to the medication given the population that you folks serve?
Yeah, as part of our sort of program implementation, we really looked for nutrition educators that were registered dietitians or had significant nutrition training so that as they're doing their cooking classes and store tours, we often have people say, I have high blood pressure, I have diabetes, lots of different chronic illness and medications. And so we're hoping that the dietitians would, in an appropriate manner, perhaps after class, take that person aside and really talk about what they could do to modify the skills that they just learned to meet their medication needs. So yeah, we purposely have trained nutrition professionals out in the field so that they can do that. And it's common, very common, with this low-income population.
I actually have a question for the group. You know, I think in the work we do now, and I've worked for years in public health for the city of Portland, and I feel like, you know, we all get it. We get that we have nutrition issues, weight issues with our culture, but do you hear in a sense that we don't hear of either what resonates or, you know, we know some of the hypotheticals of the barriers, but do you hear in your interactions kind of how can those messages be spun so it actually works? Is it about the budget? Is it about the look? Is it about the taste? What do you guys hear?
I think so much of it is really about money, and it's about marketing, and it's about the billions and billions of dollars that are spent to not educate people accurately in our society. And it's really criminal when you think of it. Between soda, between cigarettes, low fat, high fat diet, but it's high fat, it's low sugar, but it's high. And so really our biggest challenge, I think, is to once again practice what we preach as healthcare professionals. We need to be knowledgeable, we need to be compassionate, we need to look at the layers of the patient we're looking at any moment in time. What might their perspective be? What's their culture? What might they know and not know? That being said, really it's always important to provide the alternatives. What do you eat? What did you have for breakfast this morning? And find out about that particular person. And then, as you say, it's wonderful. You're in Hannaford. You can walk around and say, oh, you have that? Why wouldn't you try this as a healthy alternative? So we have to be knowledgeable, we have to be calm, and we have to really listen. And we really have to train all of our young professionals here to really fight big business and to just fight it all the time, because we're this big compared to, and it's pharmaceuticals. Half of the things that we talk about, these systemic diseases, are preventable with recommendation lifestyle. So if every one of our students that we graduate here at UNE understands that no matter what their profession, they are armed with making the lifestyle recommendations and nutritional for their patients, then we are warding off a next generation who live on pharmaceuticals.
I think that's a great point as far as listening, obviously, and letting them come to the realization, letting them kind of figure it out, and let them find their answers. Like you said, what do you eat for breakfast? And when we talk about like 5 a day and getting more fruits and vegetables, well, if we're going to have 5 fruits and vegetables every day, and we eat typically maybe 5 times a day, 3 meals and 2 snacks, then we could have a fruit or a vegetable every meal or snack, right? That's one way to do it. And so if you ask, what did you have for breakfast? Well, if you had cereal, that's great. You had your grains and your milk. Well, maybe tomorrow, if we're going to have a fruit and vegetable every time we eat, what could you have with that cereal tomorrow? And just letting them kind of come to the realization. Same with, as far as price point, it may seem less expensive for the junk food, but we can ask them, you had a bag of Doritos for snack. Well, how'd you feel in an hour? Were you still hungry? Did you want another bag of Doritos? Did you want an apple? Did you need to eat again? And so if you add those two up, if you had, 2 bags of Doritos, then, it's not necessarily less expensive if they would have started off with something with a little bit more protein or fiber or something like that. So just getting them to think, oh, well, how did you feel an hour later? Kind of let them to come to the conclusion sometimes seems to resonate more.
I'm kind of switching gears, so if you want this back. This is more for you guys, but anyone that has any ideas on this topic. I've had some experience working with the backpack program, and the problems seem to inevitably run into is the fact that you're on a limited budget and you need to provide foods that are not going to spoil before they get home or spoil over the weekend if there isn't refrigeration. And I was wondering if you guys have come up with good ideas to put in the backpacks for these kids.
Yeah, I'm aware of several of our Healthy Maine partnerships that are in the backpack program, which is we're actually printing some healthy snack ideas and information that goes home in the backpack, along with some food items that that child may be able to eat over the weekend, because otherwise they may not have any food at home. So we're often doing dried fruits, granola bars, small packs of cereal, those types of things that are shelf stable, that will last over the weekend. The small individual fruit packs where they're packed in individual servings is what I've seen. Anybody else?
Whenever I bring food to the food pantry, I always inevitably have peanut butter and tuna there, because, you know, the protein, again, to stay with you, and shelf stable. So those are my two staples that I always bring.
Also, almonds are great. Raw almonds are terrific. And, you know, a lot of fruits and vegetables are stable. Small little tomatoes and baggies. Patients have to learn to cultivate those tastes. If you're going to give a little kid a bag of little cherry tomatoes for the weekend, they're going to say, ugh, I don't eat those and all. And yet, if they begin to cultivate tastes for these fruits, apples last a long time. So the concern about the dried fruits is that is very high concentrated sugar, and as the dental community, we worry about that as well, because then they're eating this constantly from these little bags over a period of time like a treat, and then you have that every 7-minute acid attack on the teeth. So we are very conscious in the dental world of, if someone's going to have that snack, we recommend after school, if they have the ability to have refrigerator, cheese, almonds, peanut butter, but let's do the anti-cariogenic, because so much of what we do, this snacking, is what is truly, truly changing healthy mouths into just devastated oral conditions.
Just something small. When you were asking if there's anything that catches our attention when it comes to learning about health, for me, it's a more visual thing. You know, I'm 25 years old. You can tell me all day long that vitamin water is bad for me, but I saw water on the label and I bought it and I drank it and I loved it. But in our class, we had fellow, you know, classmates actually show us the amount of sugar. So he poured from a cup into a bag, it was disgusting. And I promise you, since then I haven't touched, you know, artificial water or anything sweetener like that, because it's terrifying. So even with little kids, like as dentists, we can tell them this is going to give you cavities, but I'm in the mood to scare them a little bit. I plan on showing a picture of a cavity. I'm not going to show something absurd, but I think visually that's going to shock some people. So when you say diabetes and blood clots, like show pictures of obese individuals and, you know, swollen legs, and I don't know, nothing too scary, but just let them know what those problems actually are, because, you know, a couple of the drugs, I don't know what they are. So somatostatin and stuff, yes, cholesterol, but all the rest of them, you know, maybe you give us a little bit more info on that stuff.
I think one of my biggest barriers to proper nutrition is definitely time. I mean, I come to school at 8 a.m. every morning, and I'm here till about 5. On a good day, I can squeeze in an hour at the gym. I race home, change my clothes, eat dinner, and I'm back here until almost midnight. And if I'm lucky, I'll get 6 hours of sleep. I just don't have time. I mean, I'm a terrible cook. I don't have time to learn how to cook. I don't have time to look up recipes. And I think if we could provide simple recipes for people, it would really go a long ways. It would inspire them. You know, you could show them what's something easy that they could, you know, make out of the things that they would probably already have. I think this idea of things you put in a backpack that can last a while. Maybe if you have some time on Sunday, you could make a few meals that'll last throughout the week. Simple things maybe you can set up, like if you had a few base ingredients or like a broth or something, I don't even know, that you could just you could add a few more things and supplement, and then make a variety of different meals from these base ingredients and foods that you've put together earlier in the week. I was curious, to the girl who said she was allergic to all the fruits and vegetables, does cooking them affect your allergic reactions at all? I mean, I've come across similar things with a lot of my friends who are allergic to various fruits, and sometimes just cooking them breaks down the enzymes and makes them edible, and that's a way that they can get those fruits that they need to get. And if you could provide just recipes that would have cooked fruit in it. I mean, there's not a lot of cooked fruit recipes that don't have a ton of sugar in them. And so, I don't know.
Just a quick follow-up on the marketing. You know, I think something that I would encourage everyone here to kind of be in tune with is public policy and things like marketing. You know, we did, speaking of sugar-sweetened beverages, when I was back at the city of Portland, we ran this, I mean, money. They have over $3 billion. We had, you know, $30,000, but a social marketing campaign about sugar-sweetened beverage consumption. And it was no sooner than a press release, you know, came out that we had the Coca-Cola and lobbyists in our office, and, you know, threatening to, you know, give us a FOIA where they request all your documents because, you know, we didn't even say the word soda, but it was just about sugar-sweetened beverages. So I think marketing is huge, and also public policy. So the comment about the backpack program, not that this is up for policy, but, you know, just these interesting policy implications. So SNAP recipients actually get their benefits once a month. There are some people who think if we could make it so they got them twice a month, that folks could buy more perishable food items. So when you get it once a month, one of the complaints is you can't buy a lot of fresh produce because they're going to go bad. And most of three-quarters of the purchases are made within the first 5 days of receiving your benefits. So things like that are just good to think about too, in terms of all your spare time and everything you do outside of your jobs.
We've got 10 more minutes. Closing thoughts, observations. I'd love to hear what you think of this forum style, because we may do it more if you like it, but if you don't like it, now would be a good time to tell me.
I just wanted to make a quick comment. I think all the presentations really tied into each other. There was a group who talked about patient-doctor relationship or patient-professional relationship, and that's really in my opinion, the start of it all. It's important for whoever you're informing to trust you and to respect your opinion. And for me, as an OT student, and hopefully future OT, a huge portion of my profession is education. Educating clients on how can we make sure that you are able to participate in this activity? How can we make this easier for you? And nutrition is something that crosses all medical professions and how we function in our daily lives. And I just really appreciated each profession's input, and I think it really emphasizes the importance of interprofessional communication, the fact that we're all giving the same message. So,
thank you. Anyone else? Closing comments, thoughts, opinions? Well, thank you all to the presenters, those of you who are still here, and thank you all for being part of the conversation, and go forth and eat well.